Hello, everyone. This is Dr. Michelle Gamble. I would like to share with you a case study involving diagnoses of type 1 and type 2 diabetes, obesity, insulin resistance, depression, anxiety, a variety of behavioral issues, including aggression and physical violence, as well as diagnosed psychotic disorders of bipolar, schizophrenia, among many others. I would like to begin by reminding you that I am not a physician, dietitian, nutritionist, nurse, or conventional medical professional. This document and presentation is for informational purposes only. Anything that you hear or learn here is to be utilized, taught, and shared at your own risk. I'm Michelle Gamble. I'm a health educator and an integrative wellness specialist, and I claim no responsibility to any person or entity for any liability, loss, or damage caused by or alleged to be caused directly or indirectly as a result of the use, application, or interpretation of the information presented. This case study is not intended to replace a one-on-one relationship with a qualified medical health professional, and it is not intended as medical advice. It is a sharing of my knowledge and information based on the research and the experiences that I've had. I'm not treating, curing, diagnosing any condition or illness. If you have a condition that requires medical attention, I encourage you to make your own healthcare decisions based on your research and in partnership with a qualified medical healthcare provider. The client in today's presentation is an African American female who was 16 years old when we started working together. She was 5 feet 1 inch, approximately 180 pounds due to a recent increase of over 70 pounds in the previous year. She experienced conditions of bloating and gas, which was frequently misinterpreted as possible pregnancy, and of course several pregnancy tests were done only to confirm that she was not pregnant. She also experienced various symptomology associated with PMS, and these symptomologies were accompanied by an increase in aggressive and compulsive behavior. Her clinical presentations included diagnoses of moderate mental retardation, with testing revealing an IQ of 40 to 50, depending on the agent that was doing the testing. She also had a previous diagnosis of type 1 diabetes with an A1C that was being controlled with insulin and other medications at 7.2. She had recently discovered follicular cysts in consistency with a diagnosis of PMDD. She also had severe scoliosis, which could not be alleviated due to her age. She was at the end of her growth cycle, and this occasionally led to back pains. She also experienced a myriad of psychiatric diagnoses and symptomology, including bipolar, aggression, hallucinations, schizophrenia, insomnia, significant attention-seeking behavior, and compulsive behaviors, including stealing, especially stealing food. The goals of the client, per the adoptive mother, because this is a minor, the goals included, number one, to lower her A1C without the use of medication, to investigate the original diagnosis of type 1 diabetes, and to explore orthomolecular approach or nutritional approach to addressing the root causes of her myriad of psychiatric diagnoses of bipolar, her aggression, her hallucinations, her anxiety, her schizophrenia, insomnia, and her attention-seeking compulsive behavior such as stealing. She also had the goal of stabilizing her overall health and behavior in order to prepare for the transition to a permanent long-term facility for persons with disability due to her diagnosis of being moderately retarded. Prior to working with us at Sankofa, the patient or the client had worked with a pediatric endocrinologist who had given her the diagnosis of type 1 diabetes, as well as several psychiatrists and behavioral therapists. The psychiatrists prescribed a variety of psychotropics, including Abilify, clonazepam, flurfenazine, and several other medications at different points in time. In order to control or manage her quote-unquote type 1 diabetes, she had been prescribed 2 different types of insulin, including Humalog with meals on a sliding scale depending on her blood glucose numbers, as well as Lantus at bedtime and metformin. Some of the clinical pearls that we discovered during our discovery session were as follows. She had a family history of diabetes, as well as a maternal history of drug abuse and mental issues, as well as child abuse and neglect. There was also the possibility of sexual abuse and trauma in this young lady, and she had been placed in foster care at a very early age of 2 and had experienced several different placements in her short amount of years on this planet. She had multiple placements due to her behavioral issues, and behavioral issues tend to be worse during her menses, as reported by her adopted mother, who was previously her foster parent. We also have indication of what I'd like to refer to as too many hands syndrome, and very indicative of the compartmentalized care that we have in our society, unfortunately, today, where there were several different medical practitioners who did not talk to each other, and the mother was concerned that there was cross reactivity with certain medications that were being prescribed, and there was not a consistent person being able to manage all these various different types of quote-unquote medical interventions. There was also a lack of stability in terms of not having consistent guardianship and a person to create consistent boundaries with regards to her diet and monitoring of her food intake. We were able to acquire testing on a limited basis. We did acquire results from a test with fasting insulin and C-peptide and antibodies testing. Both of these revealed that she was not a type 1 diabetic, and she later received the diagnosis, a modified diagnosis of type 2 diabetes from a new pediatric endocrinologist. We also obtained a comprehensive wellness panel, including a CBC and CMP, the CBC with differentials, and we also obtained a limited food sensitivity panel, which revealed a sensitivity to gluten, potatoes, and a variety of other items. We encouraged the guardian, the adoptive mother, to look into obtaining more testing, such as comprehensive stool panel, pylorrhea, an oat test, immune testing, 23andMe testing, and a Dutch testing. All of these were not able to be obtained due to financial limitations. After completing our intensive case review with the client, we came up with the following wellness protocols for this young lady. The following were dietary and lifestyle protocols, including the removal of refined and reactive foods that were identified in the food sensitivity panel, including the removal of dairy and gluten. Also, an emphasis on the consumption of low glycemic foods, and to have the guardian, the parent, check her blood glucose response after consumption of the introduction of various types of starchy carbohydrate-based foods. We also encouraged the integration of anti-inflammatory foods and herbs such as ginger and turmeric and other items that would have an anti-inflammatory effect, and foods rich in omega-3 fatty acids. We encouraged her to integrate exercise on a consistent basis. The parent agreed to ensure that the child was placed in a PE class at school to have exercise daily, as well as exercise at home in the form of walking, The child also engaged in dance activities, yoga, and stretching. The parent also implemented intermittent fasting routine, which consisted of regular meal times and a cutoff for meals as late as 7 p.m. After 7 p.m., the child did not eat until awakening the following morning, which usually gave a fasting time of 12 to 15 hours, depending on whether it was a midday or weekend day. Also, there was fasting of 4 to 5 hours between meals, which meant that there was no snacking. There was also the implementation of a regular bedtime routine of 9 p.m., the removal of all lights and distractions to ensure a more restful sleep, and to remove excitatory videos, TVs, music shows, and things of that nature. The supplemental protocol included the following: integration of glycine, vitamin A, D, E, and Czyme in order to assist the retraining of the cells to become more sensitive to insulin. We also integrated the use of niacin, stress-zyme, and 5-HTP along with omega-3 fatty acids to help to bring balance to the behavioral symptomology that she was experiencing. This was to emphasize the methyl pathways and the liver detoxification pathways. We also had the integration of hepatosynergy to once again help with the detoxification pathways that seem to be compromised in this young lady. Last but not least, we integrated support for the digestive system because the young lady had a tendency of eating very quickly and not chewing very much, and also the symptomology of bloating after certain consumption of certain types of foods. We integrated the supplemental protocol of super digeszyme and a generic type of probiotic in the form of Strenthia. I'm happy to report that the outcomes have been absolutely phenomenal. She has been able to maintain an A1C between 6.6 and 6.8 with no medication at all. She was also able to maintain a weight of 100 pounds for a year, and she had become an A student in school in her class, which was a class for special needs children, which means that her behavior had improved tremendously. She was no longer violent, and she no longer had the symptomology of hallucinations and suicidal tendencies and things of that nature. Even after removal of the birth control, she had no return of premenstrual symptoms. She also had, as I noted before, minimal behavior issues. The only thing that could not seem to be rectified were her stealing and her behavior which manifested in terms of lying, which was due to at times being able to not take accountability for certain things. Her sleep had improved where she was able to sleep through the night, and she had minimum bloating, which only occurred after eating certain foods. Before ending our case study, I would like to share with you the suggestions that were made for this client in terms of moving forward. Unfortunately, a lot of times we get very happy with the results and the outcomes that we get, and we forget that this is actually the beginning of the journey. The hardest part of health and healing is realizing that it is not the destination, but the journey, and it's a constant set of challenges that come about, and maintenance is some of the most important features that we need to focus on. We encouraged her to continue her current protocol with support, given the fact that this is a person that is cognitively delayed, which has a lot of complications in terms of processing and not ever going to be able to understand the importance of certain things, there is a need for support, not only with the parent but others in the community, to help this child, this young adult, to be able to continue the protocol because of the psychiatric implications. Any deviation from the protocol would likely trigger a relapse of psychotic symptomology. We encourage her to continue supporting the digestive system and providing ample support for the detoxification pathways. We also encouraged the parent to continue monitoring, because in this case the client is not able to continue monitoring on her own, daily blood glucose measures as well as reactions to different foods. In terms of going deeper, we once again encouraged her to get further testing with a more comprehensive food sensitivity panel, realizing that it's not simply about removing the triggers, but also finding out ways in which to heal the actual digestive system. And something that would help with being able to identify factors that impede the healing of the digestive system would be a comprehensive stool panel. We also encouraged her to get a pylorrhea test to find out if there is confirmation of binding to her B vitamins and her zinc. And if this is the case, that pathway has to be supported also. We also included recommendations for doing an organic acids test, immune testing, a genetic testing, and a Dutch test to further identify possible areas of support with the adrenal system, the hormonal system, and the immune system. This concludes our case report. Once again, these were phenomenal outcomes where the client was able to balance her blood sugar metabolism and was able to resolve psychotic symptomology of schizophrenia, hallucinations, and things of that nature, all through the wonderful power of nature without the use of medication.